2 hours past surgery. I remember them telling me I'll be here for 4 to 6 hours to recover, and I didn't understand why, but now I do. I'm so exhausted.
For years, I prided myself on practicing what I preached. I'm a doctor of physical therapy, co founder of two companies dedicated to empowering people to take control of their health, and someone who has spent his entire career teaching others how to prevent injuries and avoid surgeries. I believed in the power of movement, strength, and consistency, and I still do. But then I found myself in a position I thought I'd never be in, needing back surgery.
All right, so today is the day of surgery. I'm going in literally about 10, 15 minutes. I am ready, mentally ready, physically ready. Couldn't be more ready than I am now than at any point over this journey. Ready to be on the other side of this thing.
So my journey with back pain started long before this past year and actually began in college. Funny enough, when I first injured myself, it was classic deadlifting injury, and without knowing anything better at the time, I thought I just had a hamstring strain. It took 6 months to get better and things seemed to improve. But then about a year later, I had another episode and then another one and another one, and it basically kind of became like a pattern, like clockwork. About once a year, I would have some sort of flare up. Then I went to physical therapy school at the University of Southern California and I learned how to better manage my symptoms. It was also there that I learned, hey, I'm not dealing with a hamstring strain, I'm actually dealing with a disc bulge. I learned more about my body. I learned how to live a pain-free life even with the disc bulge, and most importantly, I managed my flare-ups quite well with all the education I was learning there. I learned what movements aggravated it and how to temporarily scale back my activities and adjust my training and my lifestyle to keep it under control. I learned how to build a more robust and a resilient back. My flare-ups, they went from 6-month debacles every year to essentially a 4 to 6 week modified training and a rehabilitation plan every other year. Most importantly, though, my flare ups, they were never debilitating. It was just something I had to stay on top of, an occasional reminder that I needed to be diligent with my prehab work. And then that all changed this past year. For the first time ever, my usual strategies weren't enough. The flare ups became significantly more frequent, and the recovery periods between flare ups, they became even shorter. The pain also became significantly less predictable. My clinical presentation was completely different. It wasn't just an occasional inconvenience anymore, it was starting to dictate how I lived my life. I had to limit social, gym, and sporting activities significantly more than I would have liked, which I didn't realize it at the time, but I did now. It significantly affected my own self image and what I thought of myself. Unsurprisingly, I also battled depression throughout the entire year, and that's when I knew that something had completely shifted in my presentation and also how I needed to treat it. As a physical therapist, I was in a really strange position because I knew what I was supposed to do. I had helped countless patients navigate similar issues and had literally written almost the majority of the lower back programming on the Prehab app. I had helped so many people avoid surgery, and through proper intervention, I wanted to believe that I can also do the same. The mental battle, it was just as difficult as the physical one. Was I just not doing enough? Was it just my depression or psychosocial factors? Or maybe worst of all, if I ended up needing surgery, what did that mean about me? Did that mean that I had failed? I wouldn't have admitted this at the time, but deep down, I wrestled with the uncomfortable truth. If I couldn't help myself, what did that say about me as a physical therapist? Did that mean that I was a failure? But before I could even think about surgery, I had to accept something else first. I couldn't do this alone. For the last 13 years, I had basically been my own physical therapist. I wrote my own rehab plans and modified my own workouts. I adjusted my own movements. And honestly, I was convinced that I can keep my bulging disc at bay just on my own. And for years, that belief honestly was justified. But at a certain point, I realized that I was getting in my own way. I was too close to the problem. If this were a patient in front of me and you were seeing me here in Culver City, I would have made completely objective decisions. But when it was just me, my own biases, my own fears, my own frustrations, it completely clouded my judgment. So in April of 2024, I made the decision that I needed a team. The first step was handing over my rehab plan to someone I trusted. Dorian, our director of education, you've seen tons of his videos here on the channel. He became my lead physical therapist, and I let him lead my entire plan of care because I knew I needed an outside perspective.
So Mike's having some sensitivity in his low back, particularly like compression or like putting weight through his left leg. We're having some difficulty improving that by stretching his hips. So we're trying something to actually stretch out his vertebra in his low back, his spine. So this is kind of like a traction or like a gapping technique where we're opening up some space between the vertebral segments and potentially getting some better blood flow, some desensitizing, maybe a little bit of better firing for the nerves. But ultimately, we would want something like this strategy to help improve his ability to actually put weight through his leg after his back has opened up a little bit, desensitized a little bit.
But it didn't just stop there. I also enlisted the help of 2 different dry needling specialists to help me manage my symptoms and keep me moving. Furthermore, I sought advice from one of the smartest people I know and the best orthopedic surgeon in the world, Dr. Neiman Moran, who helped me navigate my foray into true medical management. A steroid pack, for example. I had always said, like, no, I don't want to take medications. I don't want a steroid pack. Oh my God, it helps so much. As did epidural injections from an anesthesiologist and pain management specialist. I wanted to explore every single possible avenue that I could before considering surgery. And then there was another realization that even as a physical therapist, someone that went to school and had my doctorate, I needed other people to treat me. Coaches needed coaches too. And for a while, this approach definitely had worked. I'd had many, many, many good days, but I also had some bad days, and I believed truly that I could turn things around without surgery. And then August hit in 2024, the true wake-up call. That month, I went on a fishing trip to Alaska with my family, something I had been looking to and been planning for almost a half a year. A couple weeks later, I flew to Australia for a conference. Both trips were meant to be amazing and great experiences. But instead of fully enjoying them, I spent almost my entire time just managing my pain. I couldn't stand. I couldn't walk. I had to completely modify our itinerary and change what activities we were doing there. And when I got back home, the real tipping point came. Something as simple as walking my 2 little dogs, Rocco and Truman, something I did multiple times a day, became extremely agonizing and something I just was looking forward to avoid as best as I can. And it was then that I knew that it was time. I simply wasn't living life anymore, and the path that I was on wasn't sustainable. I flat out did not want surgery. I was trying to do everything possible to avoid it. To be honest, it wasn't even something I was willing to consider at first. I worked with so many patients who had gone through, honestly, failed back surgeries, fusions, disc replacements, even some microdiscectomies. And to be honest, all likely because they probably didn't need them in the first place. I had seen firsthand that people who, if they had just done like good rehab first, we probably could have avoided surgery altogether. Instead, these patients came to me post-surgically with hardware in their spines, chronically weakened core control, habitual poor movement patterns, and honestly no real understanding of how to manage their bodies. Now, we weren't just dealing with the same contributing factors that they had before that caused them to have back pain. We were now also dealing with surgical recovery on top of it, so a double whammy. Helping them get back to where they wanted to be was now an even bigger hurdle than it needed to be. So when it came to my own back, I told myself, we're going to do everything we can to avoid that outcome. I had exhausted all conservative options for over a year with this episode, and to be honest, almost about 13 years from my original injury in college. Furthermore, every orthopedic surgeon I consulted with said I was actually a really good candidate for surgery, which gave me the confidence that, hey, surgery is the right move. So 7 months later, Thursday, February 20th, 2025, I finally made the decision to go under the knife for the first time with the amazing spine surgeon, Dr. Amandeep Bala.
All right, getting ready for anesthesia. Going in, they got this nice little warm little tube, which is quite cool, keeping me real warm in here. Got boots on for a DVT.
The surgery itself was almost anticlimactic. After months, years of navigating pain, working around it, feeling like I was fighting against my own body, I literally woke up in the hospital and my nerve pain was gone, just like that. It was a really stark reminder of something I knew deep down inside, but had struggled to apply to myself. The right intervention at the right time changes everything. As a physical therapist, my natural inclination is to be conservative, to avoid medical management at all costs, and I now know I mistakenly did this for far too long. There's a reason orthopedic surgery exists. It works. Just like physical therapy works, just like dry needling can work, just like chiropractic care can work. But they all work for the right patient in the right situation, and there's a continuum of care for a reason.
All right, it's day one, about hour 30. It's been a journey. Learned a lot. Last 30 hours. I'm finally feeling a little bit better now. Back pain, my actual back pain. I just went on a walk. I've been trying to go on. I went on 3 short walks already. Got a back brace over there. Not taking the dogs or anything, but just going a couple blocks and back. And what's been cool, Rocco really wants to be pet right now. What's been cool is I haven't felt my back pain when I'm walking, which is really surprising. Even after the steroid injection, I would still feel it after 2 blocks at least. Feel something. I mean, I feel my back, I feel the surgery, but I don't feel like my hip back pain as well as my radicular symptoms, which is an awesome sign. So yeah, my back hurts because it got cut open, but I don't feel my actual back pain. Knock on wood.
My recovery outside of the initial anesthesia, which really surprised me, has been extremely smooth. I cannot believe that my stubbornness forced me to live with this pain for significantly longer than I needed to. I've been walking over 10,000 steps a day since surgery, a true miracle when I couldn't even stand or walk for more than 30 seconds before without pain. Now that I'm about 12 weeks out and I've had some time to self-reflect, I've learned 4 things from this. 1, experts need help too. I knew the research, I knew the biomechanics, I had access to all the best resources around me, but I still needed a team to get through this. 2, pain, it's insidious. It creeps into every aspect of your life, and it can have a profound effect on your mental health. 3, surgery is not the enemy. As PTs, we talk about avoiding surgery, but there's 100% a time and a place when it is the best solution. And when that time comes, it's not a failure. It's a step forward. 4th, mindset is everything. The fear, the hesitation, the reluctance to let go of my own ego, those were the biggest obstacles standing in my way. And honestly, the biggest lesson of all, sometimes the best move isn't just to keep pushing forward. Sometimes the best move is to make a change. Thanks for watching, Prehab. Remember, if you're dealing with an injury or facing a tough rehab journey, know that there is always a path forward. Stay patient, trust the process, and surround yourself with the right team. Until next time.